Hi, my name is Jessica Cooks. I'm a nurse practitioner student, and today I will be completing a neurological exam with assessment of all 12 cranial nerves. Before we begin, I would like to get consent from my patient to record the video while we're doing the exam and upload the video on YouTube so that my professor and possibly other professors and students can see. Do I have your consent?
Yes, you have my consent.
Thank you. I have completed the appropriate hand hygiene, and we are going to begin with assessment of cognition, starting with orientation. I'm going to ask you a few basic questions, if you can just answer for me. What is your name?
Mia Williams.
What is today's date?
April 10th, 2021.
What city and state are we in?
Las Vegas, Nevada.
Who is the current president?
Joe Biden.
Okay, and now we're going to assess recent and remote memory. Starting with recent, can you tell me how's your appetite?
Good.
And what did you have for breakfast?
Cereal.
What grade school did you attend?
Curtis Elementary.
What sports did you participate in grade school?
Soccer.
Thank you for sharing that. And now we're going to assess judgment. If you were walking down the street and you saw a piece of mail on the ground and it was addressed and it had a stamp on it, what would you do?
I would pick it up and take it to the nearest mailbox.
Okay, and from assessing my patient's judgment and from assessing the orientation and memory, I can also assess the speech. Her speech is clear and articulate, and I can assess the level of consciousness, which she is alert and awake and responds appropriately to my questions. And now we'll move on to assess the cranial nerves. For the first one, we are assessing the olfactory cranial nerve number 1. I'm going to have you close your eyes. We're going to occlude one nostril, and I'm going to wave an item past your nose, and you're going to tell me what you smell. So I'll wave it, and you tell me what you smell. You can close your eyes now and cover one of your nostrils. Thank you. What do you smell?
Coffee.
And can you close the other nostril now?
Lemon.
Thank you. And that is olfactory nerve, cranial nerve number 1, which is intact. And now we'll move on to assessment of cranial nerve number 2, which is the optic nerve. I am going to start with assessment of the visual acuity. I'm going to position myself 6 feet away because we're using the Snelling pocket chart. So I'm going to have you turn towards me. I want you to cover one eye. Okay, and can you read the lowest line that you can see?
LTFPH.
Okay, you can put that hand down. And now can you cover the other eye? And can you read the lowest line you can see?
LTFPH.
Okay, and can you uncover both eyes? And now can you read the lowest line you can see?
LTFPH.
Okay, and from the lowest line my patient is able to read, I can say that my patient has 20/20 vision. And now we're going to assess visual fields by confrontation. That is checking the peripheral vision. So we're going to start. I'm going to close one of my eyes. You're going to close the opposite eye. So our eyes on the same side will be closed. Okay, I'm going to close my right eye. You close your left. Yes, your left eye. And then what I want you to do is tell me when you see my fingers.
Now. Now. Now.
Okay, and now I'm going to close my left eye. You close your right eye. And we're going to do the same thing. Tell me when you see my fingers.
Now. Now. Now.
Okay, and my patient can see my fingers at the same time that I can see them, which lets me know her peripheral vision is intact. And now I'm going to complete a fundoscopic exam. I'm going to get pretty close to you. I'm going to place my hand on your forehead, and I'm also going to, you're going to feel a light touch, and there's a light here that's going to shine in your eye. Is that okay?
Yes.
Okay. Can you scoot your, thank you. I'm going to place my right eye to the patient's right eye. We're going to use my hand to brace so that my face doesn't go in too close to the patient's face. And just for steadiness, I'm going to place my hand on top of the patient's forehead. Okay, and coming in at a 15-degree lateral angle. Okay, I can see the retina is bright orange with no cotton wool spots and no exudate. I can see the optic disc. I'm going to try to, yes, can you try to keep it open? Perfect. The optic disc, the optic nerves, and the vessels. There's no AV nicking or anything abnormal of the vessels. The cup to disc ratio is 1:3, and the disc is sharp. I'm also going to check the left eye. We're going to do the same thing. My left eye to your left eye. Okay, I can still see the retina with no cotton wool spots. No exudate. I can see the disc margins are sharp. Cup to disc ratio is 1:3. No AV nicking on this side as well. Okay, thank you for that. Okay, and now we're moving on. We're going to actually assess 3 cranial nerves moving forward. We're assessing cranial nerves 3, which is oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens. And now I would just like to mention, by assessing the downward and the medial motions of the extraocular motor, we are assessing cranial nerve 4, which is trochlear, and by assessing the lateral movements, we are assessing the abducens. So I am going to start. We're also going to check for nystagmus, and we'll check to see that convergence and accommodation is intact. I want you to keep your head still. I want you to follow this pen light, okay? Okay, and I can see that the eyes are consistent. She's able to follow the light, and there is no jerky movements of the eyes. And now I want you to look at the pillow there, okay? And now look at this pen light, and keep your eyes on the pen light. Continue to follow it. Okay, and I can see that no nystagmus is present, and convergence and accommodation is intact. Okay, and now we are ready to go back to cranial nerve 5, which is trigeminal. I am going to assess the 5th cranial nerve. So now this part also requires touching. I'm going to start. I'm going to place the object on your forehead, and then you tell me if the object is soft, is it soft or sharp. And then I'm also going to place an object on your cheek, and you tell me the same thing. Okay, so each time you feel the touch, you tell me the type of touch that you feel. So I need you to close your eyes for this part. Okay.
Sharp. Soft. Sharp. Soft.
Thank you. Okay, and now I am going to hold your face, and I want you to clench your teeth. So I want you to open first, and now clench your teeth. So I can also see that she's able to move her jaws against resistance, and the sensory in her face is intact. So next we're going to check the 7th cranial nerve, which is facial. We're going to start. Can you wrinkle your forehead? Very good. And can you puff out your cheeks? Very good. So we see that cranial nerve 7 is intact. And now we're going to move on to cranial nerve number 8, which is the acoustic. And I'm going to start with the Weber test. I'm going to occlude your ear. I'm going to whisper a word, and you tell me what you hear. So we'll do a 2-syllable word, and she's going to say the word aloud that I whisper.
Apple.
And I'm going to do the other side.
Baseball.
Very good. And now we're going to do the Weber and Rhine test, starting with the Weber test. So I want you to tell me, which side do you hear the ringing when I place this on your forehead?
Both sides.
Okay, and just hearing the ringing on both sides is the normal reaction. And now we're going to test we're going to do the Rhine test, and I'm going to place this behind your ear. You're going to feel ringing. You tell me when it stops.
It stopped.
Do you still hear it in your ear?
Yes.
Okay. And what about this side?
It stopped.
Do you still hear it in your ear?
Yes.
Okay, and she should still hear the ringing in her ear because air conduction is longer than bone conduction. Okay, and now we are going to move on to cranial nerves 9 and 10, which is the glossopharyngeal and the vagus nerves. Okay, so I'm going to have you swallow. Very good. And now I'm going to have you open your mouth. You're going to say ah. I have this tongue blade. I'm going to place it on your tongue, okay? As we continue the test, I'm going to move it further back because we're going to also check the gag reflex. You ready? Say ah. Very good. It's okay. Okay, I'm sorry about that. The gag reflex is intact. And we can also see when she says ah, the uvula moves back and forth. So we can see that that is intact as well. So now we are going to check cranial nerve 11, which is the accessory. So I am going to have you lift your shoulders up and I'm going to press down and you continue to lift up. Very good. So I can see that she's able to move her shoulders against resistance, and I'm going to have you turn your head this way. I'm going to push against your head and you turn back towards me. Okay, so the trapezius and the SEMs are intact because she's able to move her shoulders and her neck against resistance. And lastly, we're going to check cranial nerve number 12, the hypoglossal. I first want you to start by bringing your tongue out and moving it side to side. Very good. And now I'm going to push your tongue. You push it against resistance. Very good. And we can also see that cranial nerve 12 as well as all of the other cranial nerves are intact. So next we're going to assess the functions of the cerebellum. Since I have you sitting, we're going to start with rapid alternating movement. I am going to have you turn your palms up, and then we're going to place your hands on your lap and then the back side of your hands, okay? So the front side, the back side. Do it again. And now do that as fast as you can. Very good. So now I can see the movements are not jerky. They're consistent and coordinated. So there is no problem there. And can I have you stand? I'm going to have you walk. Okay, you can just walk to this spot here and then walk back. Okay, I can see that the gait is steady, the balance is good, and it's smooth and coordinated. Okay, and now we're going to do what's called the tandem walk. We're going to place your heel in front of your toe, either one that you choose. So the right heel in front of the left toes, and now we're going to do the same. Heel in front of toe, heel in front of toe, heel in front of toe. Very good, and can you go back the same way? Very good, and now we're going to go back to the point you went to this way, but we're going to go on your heels and you're going to come back on your toes. Very good, and we can see that she's able to complete all of those tasks. And now that I have you standing, can you place your arms out, hands up? Very good. I'm going to have you close your eyes. For this one, I would have the patient, for the Romberg test, she would stand in this position for 30 seconds, and we would see that she's able to maintain her balance. And since she is, okay, you're going to feel me push down on your hands, okay? And this is the pronator drift. Good. We see that her hands return back to the starting position. You can sit down. You can open your eyes too. And now that we are done with those tests, checking the cerebellum, we're going to move on to check the sensory. Okay? So we're going to start. Okay. With the sensory test, I'm going to start with the just a 2-point discrimination. So I am going to place this on your skin, and you tell me if you feel 1 or 2 points, okay? You can close your eyes.
1, 2.
Okay, we're going to do the other side.
1, 2.
Okay, and I'm going to do the same thing to your arm. You tell me if you feel 1 or 2 points.
1, 2.
Okay.
2, 2.
Okay. Okay, and I want you to close your eyes and I want you to tell me which side, left or right, of your body I am touching.
Both.
Okay.
Left. Right.
Very good. You can open your eyes. And now we're going to do a test called the graphesthesia. I'm going to have you hold your hand out, and I'm going to trace a number or a letter on your hand, and you tell me what number or letter it is.
3. 8.
Okay, and we're going to do the other hand.
8. 3.
Okay. Okay, and thank you for that. Okay, and now we're going to move on. I'm going to check the tactile sensory in your upper and lower extremities. So we're going to put an item on your arms and on your legs while you have your eyes closed. You tell me if it's sharp or if it's soft.
Okay. Sharp. Soft. Soft. Sharp.
And now I'm going to do your legs.
Soft. Sharp. Soft. Sharp.
Okay, thank you for that. And now that we are done with sensory, we're going to move on to motor. So I am going to start by testing the strength of your hands. I want you to grip my hands, both hands, very good. Okay, so while you're holding my hands, I'm going to push, you push back towards me. Very good. We're just checking for resistance. Now hold your hands straight out. You can make a fist and hold them out. Don't allow me to push your hands down, okay? Perfect. Don't allow me to push your hands up, okay? Perfect. Okay, and put your hands at your side, please. Okay, we're gonna start on the right side. I wanna pull out, but you pull towards you, okay?
Yes.
Very good. And now I'm gonna push your arm, but you push it towards me. Very good. And we're gonna do the same thing on the other side. We're gonna come out first and in. And you remember, you keep it the opposite way of me.
Okay.
Very good. Very good. Okay, and we're gonna check your legs as well. So can you, that is perfect. Okay, so I'm gonna push your leg up, but you push it back towards me. Very good. And now the other way. Good. Push it up towards me, and now back. Very good. Okay, so in order for us to check for the hip abduction and adduction and just the external rotation of the hips, I'm gonna have the patient lay down for this one. So is that okay if we have you lay down? Okay. Okay, and still, I am checking the strength as well. Just lift your legs up. I'm gonna resist and you don't let me push them down. You can lay your back down, yeah, that's fine. Okay, let's try that again. Lift your legs out, straight up. Lift up, good, okay. And then I want you to bend at the knees here. Okay, I'm gonna try to open your legs. You keep them closed, okay? Okay, good. Now open them slightly. I wanna close them, but you keep them open. Okay, very good. And now we're gonna lay the one leg down, and I'm just gonna turn this hip leg in, and I'm just gonna open it up. Very good. And now we're gonna put this leg down. Can we lift this one up? And I'm just gonna turn it in, and I'm gonna open it up. Very good. Now, since actually while I have you in this, we're gonna start with the deep tendon reflexes. We'll start with superficial. I am going to check the Babinski. This is the plantar flex we want to see. I'm going to place the reflex hammer against her foot and see if we get a response. Okay, as you can see, that is the expected response. Her feet are flexing as opposed to them separating. I'm going to do the same thing to your other foot. Okay, good. And you can get up now. We'll continue with the deep tendon reflexes in the chair. We just want to use this one to try to get a little dangle from the feet. So we'll start from the bottom and keep working our way up. Okay, I'm going to start with the Achilles, which is the back of your ankles, okay? Okay. There is a small twitch in her foot on both sides when I hit the back of the Achilles, so that reflex is intact. Okay, and you're gonna feel, I'm gonna bump this onto your knee. Okay, and we can see her toe does move when I do the patellar. Okay, we're just gonna do that one more time. There's a slight movement in both of them, which means that reflex is intact. Would you prefer to sit in that chair? Okay. Yeah, this chair isn't that comfortable for the patient, so for the remaining tests, we'll do a chair that is more comfortable. So next we are going to check the biceps. I'm going to start by pressing on the biceps. And we do see movement of the thumb. There's a slight movement when we press there. And there is a slight movement on both sides. So now we're going to check the triceps. Okay, I'm going to place your hand over my arm. Okay, can you relax it more? Just relax it. Just let it relax. Okay. Okay, there is slight movement, and I can kind of like feel the triceps moving. So we'll do this other side. I'll stand for this one, okay?
Mm-hmm.
I want you to let your arm dangle here. Yeah, just. Okay, there is a slight jump of that arm too. So that means all of the reflexes are intact, and that completes our exam today. Thank you for your participation, and thank you for watching.